So, Dr. Anderson, what can you tell us about where the vaccines are being rolled out this week?
Well, I only have direct information about what's going on in Manitoba, but very pleased to let the audience know that as of between Thursday and yesterday, we have sent vaccine out to 17 different First Nation communities in Manitoba, with plans in place to get the vaccine out to most of the rest of this week.
There's a lot of, a lot of people very eager to get vaccines, but on the flip side of that, there's obviously a lot of people who are hesitant about the vaccines. As a doctor, what do you tell people when they're saying, well, I'm not going to be a guinea pig, right? Which I think people are, there's more than a few people that are feeling like that. What's your advice to them?
So I think let's look at the credible sources of information and what we know. These vaccines have been studied between Moderna and Pfizer in over 70,000 people. And I looked online this morning, and different trackers are reporting the vaccines have been given to something like 25 million people worldwide. Both vaccines have gone through rigorous approval processes, not just in Canada, but in the United States, the UK, Israel, other countries. So I think actually a lot of work has been done to show that these vaccines are in fact safe, and that the risk of getting the vaccine is much lower than the risks of what we're currently seeing from COVID-19 illness in our communities.
Okay, we've got a couple questions from our viewers. Dale says, you still get COVID after your vaccine shots. I mean, you can pass it on to other people. You have to stay 6 feet apart, washing your hands. You've been told since you were a child. As First Nations, traditional medicine should be at the top of our list to protect against COVID. What do you have to say to that?
So the vaccines, the Moderna vaccine and the Pfizer vaccine are 94 or 95% effective, which means, in fact, yes, some people will still get COVID after being exposed to it, but those numbers are much lower. It's very true that they don't replace the need to practice the other public health measures. We still need to physically distance. We still need to stay home if we have symptoms that could be from COVID. Because we don't want to pass on COVID in the small chance we do get infected after we have the vaccine, or we don't want to pass on what other illnesses or viruses we might have that are giving us those symptoms. I really encourage people not to think about vaccines and traditional medicines as an either or. As Indigenous people, we can use traditional medicines and Western medicines together. And so, again, I would just encourage people really to think about using both to support your health and wellness individually, family.
So Deborah has a question. Will the effectiveness of the vaccine be compromised if the second dose is delayed?
Yeah, thank you for that question. As folks know, Pfizer's meant to be given 21 days apart and the Moderna vaccine 28 days apart. It's only been studied at those intervals. What we are planning for with Manitoba First Nations is that we might have a week or two delay, and the evidence suggests that that will not change the effectiveness at all. But certainly as more doses are given and more is learned, we will adjust that approach if needed.
Excellent. Dr. Anderson, thank you so much for taking the time to join us today to chat about these vaccines. It's always nice to hear from you.
Thank you, and anytime.